Welcome to the Foot Health Facts Podcast, powered by the American College of Foot and Ankle Surgeons. I'm your host and a fellow of the college, Dr. Matthew Dairman. We're kicking off a three-part series on heel pain, one of the most common reasons people find themselves in our offices. Joining me is fellow foot and ankle surgeon, Dr. Michael Kelly, practicing in Nashua, New Hampshire, who knows a thing or two about helping people walk without wincing. Michael, welcome to the podcast.
Thanks for having me. I appreciate being here.
Sure. Before we get into it, give us one fun fact about you that has absolutely nothing to do with feet.
I have twins, a boy and a girl. They just turned one a few days ago. It's been a fun, exciting new life challenge, adjusting to a new normal. More interestingly, I also have four siblings, two of which also have twins.
And your wife knew this going in?
She did. She was actually hoping for twins, and we were blessed enough to get them.
That's great when it all works out. All right, let's jump into heel pain. So it seems to show up in every kind of patient. Why is it so common?
Lots of individuals have abnormal mechanics or slightly abnormal foot structure, things such as muscle tightness, individuals attempting to become more physically active are weekend warriors. Sports is becoming much more common among children, and the rapid rise in obesity in our American population is dramatically contributing to the increased pressure that's placed on the heel.
Yeah, heel pain doesn't seem to discriminate, does it? We see it in runners, teachers, retirees, kids, you name it. So most people assume it's plantar fasciitis. So what is plantar fasciitis?
The plantar fascia is a ligament on the bottom of the heel. It connects the calcaneus, which is the heel bone, and then it spans across the arch and fans all the way out through the toes. And what we have is an inflammation of that ligament at the point of the heel attachment. I attribute it to three most common things, which are bad shoes, lack of arch support, and tight calf muscles.
So now a lot of people also come in, they say, I have plantar fasciitis, or they have a heel spur. Does a heel spur matter in plantar fasciitis?
I tell people to try to forget about the heel spur. One of my pet peeves is a patient coming in and they said, my primary care got me an x-ray and they said I have a heel spur and told me to come see you. And I try to nicely say, well, forget about the fact that you have a heel spur. A heel spur is a result of your problem. It is not the reason for your problem.
I couldn't agree more. It's kind of like rings of a tree. It kind of tells us how long something's been pulling more than it should.
Absolutely.
So if it's not plantar fasciitis or heel spur syndrome, what else could be going on to cause that heel pain?
Sure. There is Achilles tendonitis. The Achilles tendon attaches at the back of the heel, and we can see that with inflammation at the point of where it actually attaches on the heel or along the course of the tendon. We typically see this as a result of overuse or increased activity. Sometimes people going from a sedentary lifestyle to trying to become more active, and the tendon's just not used to it and becomes inflamed. There's calcaneal bursitis, which is an inflammation of the bursal sac on the bottom of the heel, which I see very concurrently with plantar fasciitis. Typically, that is caused by either blunt trauma or overuse as well. There's stress fractures, which are small breaks or weakening of the heel bone, commonly caused by overuse or overtraining, hard surfaces, improper shoes, and certain types of foot deformities. The main concern with this condition is that those tiny breaks or bone weakening doesn't lead into something more complex like a heel fracture if left untreated. There is a condition called tarsal tunnel syndrome, which is a compression of the nerve, specifically the posterior tibial nerve that runs along the inside of the ankle and into the heel. We have finally calcaneal apophysitis or Sever's disease, which is an inflammation of the growth plate in the back of the heel affecting children, typically between the ages of 8 to 14 years old. And we most commonly see this in children that are involved in running sports, such as soccer, football, basketball, track, and lacrosse.
Yeah, I tell patients probably about 30% of the time when they have heel pain or plantar fasciitis, there's usually some nerve component to it as well. You find that?
Yeah, and that's something with our exam that we try to figure out. And the better that we can help diagnose a problem, the better that we can help you get back on your feet and not be in pain.
Absolutely. So is there a certain type of foot or activity that's more prone to heel pain?
Flat feet or fallen arches make patients much more prone to heel pain due to the abnormal mechanics placed on the foot. I would also say that the opposite, high arched or cavus feet, given the increased arch, if you think of a tripod and you kind of shorten the length that those tripod arms are spreading out, it puts a lot of force directly through the center of the heel.
Yeah,
High
just not
impact.
not as no, I'm sorry, just not as much shock absorption in those patients, right?
Yes, absolutely.
Yeah.
High impact activities such as running, jumping, cutting, quick start-stop movements can all contribute to things that can cause heel pain as well.
Yeah. Sometimes it's just prolonged standing. And we see a lot of laborers that are in standing in one place all the time. And maybe there's a limb length inequality or something that's kind of contributing. They're just bearing more weight on that heel. As we said earlier, it just doesn't seem to discriminate, right?
Yeah,
So,
absolutely. I mean, you try to stand in place for 8 hours on a shift, whether that's manufacturer workers, cashiers, people that just stand still all day. It just puts a lot of pressure through the foot, and that shock absorption just doesn't work as well.
yeah. So what's one thing patients often get wrong when trying to self-treat?
Well, I tell them trusting Dr. Internet or Dr. Google or WebMD. I think that it's good to get a kind of baseline to maybe what your problem might be and trying to do some basic things to try to help get that pain to go away before you go in and see someone and spend a little bit more time having to take some time off work to go see a physician to assess your pain. But waiting too long to come in and get evaluated by a foot and ankle surgeon is really the thing that people get wrong. You can't always believe what you're reading, and you just don't know if it's the right path of treatment.
Yeah, it's usually, they come in before they get the diagnosis, so they think they have so many different things. And it's best to just get a diagnosis, then you can go to Dr. Google or whatever it is that your choice to do more research. But you got to trust where you get the diagnosis first.
Absolutely.
So, what do you wish every listener understood about heel pain before ignoring it for months?
Well, first is just stop ignoring the pain and expecting that it's just going to go away. The foot and ankles providers in your area can help you get you on your path to recovery when treated early. So much easier to treat pain in an acute setting and that means when it first starts or has only been around for a few days or a few weeks, to individuals that have been in pain for months or if not years.
Yeah. Thanks, Mike, for educating us on heel pain. In our next episode, Dr. Kelly and I will unpack heel pain treatments and what actually works. You've been listening to the Foot Health Facts podcast. For more information on today's topic or any foot and ankle concern, head over to foothealthfacts.org. On behalf of the college, I'm Dr. Matthew Dairman. Thanks for joining us today. If you enjoyed this episode, don't forget to like, subscribe, and share it with someone you care about. Together, we'll keep everyone moving forward one step and one topic at a time.